you've had your baby. And for most people, that baby came to be because, so you obviously know how that part works. And now that you've had your baby, it's time to start thinking about again, but maybe without the baby part this time, at least for now. Hi, I'm Becky. Welcome to Wellness in the Pelvis. I'm a pelvic floor physical therapist and a mom, and I'm here to help you understand more about your body, especially when it comes to your pelvic health. Today, we're going to talk about 7 things to expect, especially those first couple times of having intercourse after having a baby. So let's shed some light on what's going on down there. First things first, though, if you are in that 0 to 6 weeks postpartum, do not have penetrative intercourse. You need to go back into your birthing provider for your 6-week follow-up to make sure that you get the A-OK to have sex again. And that's because they want to make sure that organs are shrinking back down to how they're supposed to be. If you had any stitches, that those are healing, and that everything's just looking okay. Because you don't want to risk having any sort of infection. And besides, in those first 6 weeks, there's not a lot of sleep going on, and it's not because you're messing up the sheets, so you probably aren't really wanting to anyways. All right, so let's get into those 7 things to expect with those first bouts of intercourse after having a baby. Number 1, and this is the most important thing, you need to adjust your expectations. I tell all of my patients to set the bar so low that you can't even trip over it. Some people get so worried that sex isn't going to be as good as it used to be, or what if I disappoint my partner? Do I even remember how to do this anymore? None of that matters. Change your focus, okay? Especially now that you already had the baby. So at least for now, you're probably not trying to have another one. So the whole point of having intercourse is just to enjoy time with your partner. In those first early weeks especially, you are probably naked a lot, or at least, especially if you're nursing, don't have a shirt on, or as things are healing down below, probably walking around in the pants free club. But it's not like the sexy kind of naked. And so if you guys are actually trying to have any sort of penetrative intercourse again, you're actually going to be naked in like a kind of cute way. So might as well just enjoy the fact that you're spending time together. And for some reason, you guys are trying this, you get all set up, you think you're ready to go, and then you start getting all in your head and start getting nervous and things just start feeling super good, especially mentally. Stop. There is no sense in trying to push yourself into doing something that you don't really feel ready for. And then once you decide to stop, immediately do something with your partner that feels good. Whether it be cuddling or something physical, or watching some TikTok videos, or whatever it is that makes you feel like you're connecting as a couple. Because that's kind of the whole point of having intercourse anyways. Penetration. This can be the big scary thing for a lot of people. Even if you attempted a vaginal delivery, whether it resulted in a C-section or not, the skin around the vulva and the perineum, which is the vaginal opening, got stretched way more than it's ever been stretched before. And then so as it heals, it kind of clamps back down, and your body needs to learn how to relax a little bit again. And so if anything is going inside that hole, it's not necessarily ready to just relax and enjoy. And so those first couple of times, especially of having something penetrate through the vaginal opening around the perineum, can be quite uncomfortable. And many people will say it's painful. And so what I want you to realize is that this pain isn't necessarily a bad thing. You need to respect what your body's telling you. Don't just push through pain because Becky said, but take it as a sign to maybe slow down and just pay attention, breathe, let those tissues have a minute to relax, and then see if you can keep going. But if you try to have penetration and it just isn't feeling right, back off again. Okay, like we said, there's no point in pressuring yourself into doing something that you're not ready for. Bleeding can definitely be common after having a baby, especially in those first 6 to 12 weeks postpartum when you've gotten the all clear to try penetration, but you still may have some of that lochia, which is just all the stuff that lived inside your uterus when baby was growing. That's all still flushing out at that point. Or you may have some bleeding with scar tissue that may be stretching if you had an episiotomy or a perineal tear. That scar may have a really big stretch and you might have a little bit of bleeding from there. It should only just be light spotting and it really shouldn't last more than a couple of hours. If you have a large amount of blood or if it's persisting, especially more than a couple of hours, reach out to your birthing provider. They may have some recommendations on what you need to do. Something else that may cause bleeding is just vaginal dryness. You have way lower estrogen levels, especially if you're nursing, than what you would if you weren't pregnant or just had a baby. And so please, for the love of God, use some lube. Now is not the time to be proud. So if you aren't sure if you have any lube that you like, look in the description box. I've got a couple of recommendations that I like as a pelvic floor PT. Positions. You may have had some go-tos prior to baby, and now you feel like you're starting from square one. What's going to be okay? What's not going to be okay? It's different for every single person, but here are some big picture things to be aware of with different positions. So if you, as the woman, presumably starting on your back, that can be helpful because it can help you feel fully relaxed. You can use the bed or whatever surface to relax into. The downside is, though, that you don't get as much control with the depth or force of penetration. If you as the woman are starting on top, that can be helpful because you do get to control force and depth of penetration. But sometimes having to hold your own weight up can keep you from feeling like you can relax well. Side lying is a great option because you can relax into the bed and you have a bit more control over the force and depth of penetration. The downside, though, is that you don't get to face your partner, which can be an important thing for some people. So lots of different things to consider with different positions. Really, the best piece of advice is just try different ones, and if it isn't feeling like the right thing to do, bag it for now. Elevation. After you have intercourse, it may feel pretty sore down there. Give it some time to rest and recover. Put some pillows underneath your hips to elevate your pelvis up a little bit, or lie on your back with your legs up against the wall or on the headboard of your bed, or hooked over the couch cushions if you're laying on the floor, just to let gravity help pull some swelling away from the pelvic floor. Similarly, ice can be really helpful, or at least something cool down along the groin and the perineum. Don't put anything on the inside of your vagina. That is not the smartest idea, but an ice pack through the through maybe some underwear on the perineum, or even just a cool wet washcloth directly on the skin of your vulva and perineum can feel really nice right afterwards. And lastly, this isn't necessarily your pelvic floor, but if you're nursing in particular, you may experience a little bit of leakage from your breasts when you are having penetrative intercourse. And that's because the same hormones that you get through your body when you breastfeed are kind of the same ones that you get when you have anything pleasurable happen. And so that oxytocin and other feel-good hormones, those endorphins, will go coursing through your veins when you're having penetrative intercourse, or that's the goal at least. And so that too makes it to your milk ducts and may make you actually leak. So you may want to have a bra on with some nursing pads, or have some tissues or something nearby to be ready for that little surprise. So what questions do you have? Let me know in the comments down below. Don't worry about that like or subscribe thing. It's not really my thing either. I'm just here to help you understand more about your body. If that's something you're into, watch more videos. Thanks for coming. We'll see you next time. Bye.